Episode 57 CM, January 29th, 2025 World Health Organization PM2.5 limit of 5 micrograms per cubic meter. In episode 57 CM 1 World 2 United States 3 Iowa main content 1A World leaving the WHO could hurt Americans on a range of health matters. President Trump decision to pull out of the International Health Agency could deprive the United States of crucial scientific data and lessen the country influence in setting a global health agenda. ROSEP view the World Health Organization safe limit for PM2.5 is 5 micrograms per cubic meter annually, which is lower than the United States safe limit for PM2.5. which is 9 micrograms per cubic meter annually. For that reason alone, ROSEP admires and wishes the United States would emulate the WHO realistic and humane standards based on medical and scientific research data. The many fields, including human health and environmental regulation that WHO encompasses, pave the way for countries around the world to benefit from humane policies based on science and truth. Excerpts edited by ROSEP for brevity and clarity in relationship to residents against would smoke emission particulates of 501c3 nonprofit organization. January 29, 2025 President Trump decision to withdraw the United States from the World Health Organization could have harsh consequences for countries around the world that rely on the agency to achieve important health goals, including routine immunizations, outbreak control, and nutrition programs. But it could also have unfortunate, unintended repercussions for Americans. Disengaging from the WHO would rob the United States of crucial information about emerging outbreaks like mpox and resurgent dangers like malaria and measles. Public health experts said it may also give more power to nations like Russia and China in setting a global health agenda, and it could hurt the interests of American pharmaceutical and health technology companies. The WHO work touches American lives in myriad ways. The agency compiles the international classification of diseases, the system of diagnostic codes used by doctors and insurance companies. It assigns generic names to medicines that are recognizable worldwide. Its extensive flu surveillance network helps select the seasonal flu vaccine each year. The agency also closely tracks resistance to antibiotics and other drugs, keeps American travelers apprised of health threats, and studies a wide range of issues such as teen mental health, substance use, and aging, which may then inform policies in the United States. Though it will take a year for the withdrawal to take effect, and it is not entirely clear that it can happen without congressional approval. Mr. Trump announcement has already prompted drastic cost-cutting measures at the WHO. The WHO was months late in acknowledging that the coronavirus was airborne and that the virus could spread in the absence of symptoms, yet there is no other organization that can match the WHO reach or influence in the world. The WHO has a modest budget totaling $68 billion for 2024 and 2025. For comparison, the health department of the state of Rhode Island spent just over $6 billion in 2024 alone. The United States is the WHO largest donor, accounting for nearly 15% of its planned budget. For the 2-year 2024 to 2025 budget, $264 million was the United States donation and $181 million was the China donation, a difference of 31%. $442 million in voluntary contributions for 2024 to 2025 was from the United States, while China has given only $2.5 million in voluntary contributions for 2024 to 2025. China total contribution is about 74% less than the United States contribution. If the United States loses access to the WHO information and data sharing, online reports and informal communications remaining may be muffled, filtered, or marred by misinformation. The WHO and other countries are not obligated to share information such as genetic sequences with the United States, let alone heed its advice. If the country is not a member, if we are not there, we do not get to have a voice at all. The WHO began in 1948 as a branch of the United Nations focused on global health. Over the decades, it led the eradication of smallpox, nearly vanquished polio, and has helped control use of tobacco and trans fats. Countries that do not have the equivalent of a CDC or a Food and Drug Administration rely on the WHO for public health guidelines, childhood vaccinations, and drug approvals, among many other health efforts. Ministries of health typically will not move unless they're a WHO guideline allowing pharmaceutical and health technology companies to operate in countries that adhere closely to WHO recommendations. Mr. Trump has criticized the WHO for not holding China accountable early in the pandemic and for taking too long to declare the COVID-19 pandemic a public health emergency, but the WHO cannot reprimand its member countries. WHO has no power to compel countries to do anything. China was not transparent, and that hindered WHO response. Mr. Trump has also said that China has too much influence over the WHO, but actually the real problem is that tiny Pacific islands with 100,000 people have too much power. It is unclear whether Mr. Trump can unilaterally sever ties with the WHO. Unlike most international agreements, which may stem from executive action or require Senate ratification, membership in the WHO was enshrined by a congressional joint resolution and may have to be dissolved by a congressional joint resolution. If Congress approves, the United States must still give 1-year notice of withdrawal and fulfill its financial obligations for the year. Some experts worry that Mr. Trump action will prompt nations like Hungary and Argentina to follow suit. Already, Italy Deputy Prime Minister has proposed a law to leave the WHO. U.S. withdrawal may also empower authoritarian member states in the organization like Russia and China. Public health decisions in Russia and China are much more politically controlled, and that a danger to everybody. None of us wants to live in a world where Russia has a larger voice in global health governance. In his executive order, Mr. Trump said the United States would cease negotiations on amendments to the international health regulations, legally binding rules for countries to report emerging outbreaks to the WHO, but the latest amendments were adopted by the World Health Assembly last year and are expected to come into force in September. Ironically, it was the first Trump administration that proposed the amendments because of frustration with the lack of transparency from certain countries during COVID-19, said a woman who oversaw negotiations during the Biden administration. She also led negotiations for a pandemic treaty that would allow countries to work together during an international crisis. The treaty had been stalled and may now collapse. To ROSEP selected list of illegal Trump executive order frozen funds on January 28, 2025 for the Environmental Protection Agency, related to air pollution regulation, and 2. National Science Foundation programs. A judge put a freeze on this order, temporarily, by the end of the day January 28, 2025. Excerpts edited by Rozep for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 non-profit organization. Environmental Protection Agency Air Pollution Control Program support. $68 mil Clean Heavy Duty Vehicles Program. None reported. Clean Ports Program. None reported. Clean School Bus Program. $939 mil Clean Water State Revolving Fund. $44 bill Climate Pollution Reduction Grants. $5 mil Diesel Emission Reduction Act DERA National Grants. $140 mil Diesel Emissions Reduction Act DERA State Grants. $28 mil Environmental and Climate Justice Community Change Grants Program. $5 mil Environmental Education Grants Program. $4 mil Environmental Finance Center Grants. $5 mil Environmental Information Exchange Network Grant Program and Related Assistance. $11 mil Environmental Justice Collaborative Problem Solving Cooperative Agreement Program. $43 mil Environmental Justice Government to Government EJG2G Program. $81 mil Environmental Justice Small Grant Program. None reported. Environmental Justice Thriving Communities Grant Making Program EJTCGM. $182 mil Environmental Policy and Innovation Grants. $101,000 Environmental Protection Consolidated Grants for the Insular Areas Program support. $166 mil Financial Assistance for Community Support Activities to address environmental justice issues. $100,000 Greenhouse Gas and Zero Emission on Road Mobile Source Standards. None reported. Greenhouse Gas Reduction Fund. Clean Communities Investment Accelerator. $60 bill Greenhouse Gas Reduction Fund. National Clean Investment Fund. $140 bill Greenhouse Gas Reduction Fund. Solar for All. $7 mil National Environmental Education Training Program. $2 mil Pollution Prevention Grants Program. $17 mil Protection of Children from Environmental Health Risks. $40,000 Senior Environmental Employment Program. $33 mil State Senior Environmental Employment Program. $318K Wildfire Smoke Preparedness in Community Buildings Grant Program. $11 mil National Science Foundation Biological Sciences. $972 mil Computer and Information Science and Engineering. $12 bill Engineering. $970 mil Geosciences. $12 bill Integrative Activities. $646 mil Mathematical and Physical Sciences. $18 bill NSF Technology Innovation and Partnerships. $12 bill Office of International Science and Engineering. $71 mil Polar Programs. $464 mil Social Behavioral and Economic Sciences. $361 mil STEM Education, formerly Education and Human Resources. $15 bill 3 Iowa Rozep View Democrats still winning locally in the midst of, or perhaps in response to national chaos from the article Hedine. Iowa Democrats flip Iowa State Senate seat in special election to cut into Republican majority. The main points that helped the Democrat win the seat are the fact that Republicans in the Iowa State Senate presided over stagnant wages and defunded schools, and the state of Iowa under Republican control interfered in local control. Excerpts edited by Rozep for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 non-profit organization. Des Moines Register. Tuesday, January 28, 2025. Iowa Democrats have flipped the state Senate seat vacated earlier this year by Chris Knoyer, who resigned to become the state new Lieutenant Governor. Democrat Mike Zimmer has defeated Republican Kate Whittington in the special election for Senate District 35. Zimmer won with 52% of the vote to Whittington 48%. The Democrat won on a platform of hard work, fairness, and lowering the cost of living, although Republicans will maintain a firm hold on the chamber now with a 34-16 majority. Democrats celebrated Tuesday evening the Mike Zimmer victory in Senate District 35, which President Trump won in November with nearly 60% of the vote, is a clear rejection of the Republican agenda led by Kim Reynolds and the Iowa State Senate Republicans.